All right, today my favorite subject came up again at the COVID-19 briefing. Are there treatments out there that are already in use with minimal side effects that could bring relief to our people and our economy? Well, our own John Roberts pressed Dr. Anthony Fauci about the drug we first introduced to the wider public on Monday.
Dr. Fauci, as was explained yesterday, there has been some promise with hydroxychloroquine, this potential therapy for people who are infected with coronavirus. Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
The answer is no, and the evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that will give us information to determine if it's truly safe and truly effective. But the information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it.
Well, first, I have great respect for Dr. Fauci, his sacrifice for the country. But when you hear something is just anecdotal, and again, aside from the clinical terminology, to most people, and we're talking to most people in these press conferences, it just doesn't sound too hopeful or too impressive. And anecdotal doesn't really describe the findings of the world's top researchers who just a few days ago published results of their first study on hydroxychloroquine and hydroxychloroquine with azithromycin. A lot of you probably have taken Z-Paks over the years. Well, check out their findings. This is in a long study. Despite its small sample size, our survey shows that hydroxychloroquine treatment is significantly associated, the word significantly there, with viral load reduction or disappearance in COVID-19 patients, and its effect is reinforced by azithromycin. Now, look at this chart that accompanied the report. The blue line is the control group. Okay, so they took nothing. So bad for them. They all have the virus even after 6 days. The red represents those who received hydroxychloroquine, so some improvement. So only, 40% or so still had the virus. But look at the yellow line. Now, the yellow line represents the patients at the end of day 5 only who were on a protocol that included hydroxychloroquine and azithromycin. Now, the researchers in this study, and they're all incredibly prominent epidemiologists and researchers, dozens and dozens, they understood when they undertook this project, they were tasked by the French government to do this. They understood the severity of the global crisis we're all facing. And they also understood the risk to millions of people around the world, including our healthcare workers. And they concluded, as a result of all of this thinking and what they looked at, the following. We therefore recommend that COVID-19 patients be treated with hydroxychloroquine and azithromycin to cure their infection and to limit the transmission of the virus to other people in order to curb the spread of COVID-19 in the world. Now, I understand that we want our own data that is a large controlled study. I understand that's necessary, and the Trump administration is 100% correct at the same time and recognizing the benefits already reported in the use of this drug and the drug combo that we just mentioned. Now, by the way, hydroxychloroquine, a lot of people don't understand this, but it does not need to be approved by the FDA in order to be administered by doctors for off-label use. Because as I said before, we don't have to go over it, but it's prescribed for anti-malarial use and also for lupus in some cases. Our physicians are already using it in our major hospitals for COVID patients. They also used it successfully in some cases against SARS, which had a higher mortality rate. The president, as usual, has sharp instincts. He sees things that sometimes the intellectuals and the academics they might get lost in some of the details, but he has sharp instincts about things. And he's pushing to get millions of doses now into the United States.
But I'm a big fan, and we'll see what happens. And we all understand what the doctor said is 100% correct. It's early, but I've seen things that are impressive, and we'll see. It's very effective. It's a strong drug.
I can also report tonight that another drug is also showing significant promise in the fight against COVID-19. It's called Actemra. It's an IL-6, or an anti-leukin-6. It's an anti-inflammatory prescribed mostly for rheumatoid arthritis. Again, an off-label use is being implemented now by the Chinese, who are finding that it works very well against COVID-19. Pharmaceutical giants Roche and Sanofi make different versions of this drug. Our doctors and our hospitals need all the ammo they can get to fight this disease. We want fewer people to need ventilators, right? We need to reduce that absolute necessity to have vents in our ICUs because we have a critical shortage. We need to get people home to quarantine if they're sick. Then we need, after a necessary amount of time, we need to get those people healthy and back to work as soon as they're medically cleared. Again, I respect all the professionals who are working on this, and they're working ridiculous hours, and I respect Dr. Fauci an enormous amount. And I realize in an ideal world, we want everything buttoned up and it's perfect as far as randomized trials go. But our country needs solutions and hope now. And old bureaucracies have to give way to fast action. The president understands this. We can't stay in our homes forever. America wants to get back to work. And that's the angle.